Ribavirin drug for measles. Ribavirin is not an FDA-approved or standard treatment for measles. Although it has broad-spectrum antiviral properties and shows activity against the virus in laboratory settings, it is sometimes used experimentally on a case-by-case basis for severely ill or immunocompromised patients. Let's see the current clinical status of this drug. FDA status. Ribavirin is not approved by the US FDA for measles treatment. Its primary approved uses are for chronic hepatitis C and severe lower respiratory tract infections caused by respiratory syncytial virus. Experimental use. In specific severe cases, especially involving immunocompromised individuals, adults with measles pneumonia, or cases of subacute sclerosing panencephalitis, doctors may consider off-label or compassionate use of ribavirin, intravenously or aerosolized. Evidence base. While some small cross-sectional and observational studies suggest ribavirin may reduce symptom duration, hospitalization time, and mortality in severe adult cases, there are no large-scale, controlled trials proving its clinical efficacy for measles. Therefore, we follow the standard management of measles. Because there is no safe and highly effective antiviral for measles, treatment relies almost entirely on supportive care and prevention. Supportive care. It focuses on hydration, managing fever, and treating any secondary bacterial infections with antibiotics. Vitamin A. The World Health Organization and the CDC recommend high-dose vitamin A supplementation for all children diagnosed with severe measles, as it is proven to reduce complications and mortality, particularly in deficient populations. Let's study the use of ribavirin for measles. Ribavirin is not routinely recommended for treating measles but may be considered in severe or complicated cases, especially in immunocompromised children. Due to limited clinical data, dosing regimens are primarily based on case reports and clinical experience. In case of oral ribavirin, the dosage is 15 to 20 mg per kilogram per day, administered in 2 divided doses. Its total duration is 1 to 2 weeks. Optimal duration is not well established. This regimen has been suggested for patients under 12 months old with measles pneumonia, and for those aged 12 months or older with severe immunosuppression or requiring ventilation. Potential side effects include dose-dependent reversible anemia, bradycardia, and elevated liver transaminases. Intravenous ribavirin. Its dosage is 33 mg per kilogram loading dose over 1 hour, followed by 16 mg per kilogram every 6 to 8 hours. Total duration is 7 days. This IV regimen has been used in severe cases, particularly in immunocompromised patients. For aerosolized ribavirin, the total dosage is 6 grams dissolved in 300 milliliters of sterile water. Administration is delivered via a nebulizer for 12 to 18 hours per day. The total duration is 5 to 7 days. Aerosolized ribavirin has been employed in certain severe respiratory cases, though its use is less common due to administration challenges and potential risks. There are some precautions to be noted with ribavirin. Hematologic toxicity. Monitor for anemia and bone marrow suppression. Teratogenicity. Avoid exposure in pregnant caregivers. Limited evidence. Use only in severe cases where benefits outweigh risks. Given the off-label status and potential risks of ribavirin, its use should be carefully considered and monitored by healthcare professionals experienced in managing severe viral infections.